Okay, so this is an introduction to the young leaders of the ChildFair State. We are a diverse group of 26 young people from all across England, ages 13 to 21. We all have come from a wide range of lived experiences. For example, some of us have been care leavers, some of us have been kicked out of school. Yeah, some of us are affected by welfare benefits and housing and things like that.
Hi there, everyone. So my name is Shuaib Mia, and I've been with the ChildFair State project for, I think, around a year now. So it's been a fascinating and an incredible experience. I'm just really happy to be here as well.
I'm also a care leaver as a result of my family's history. Went into care when I was 10, 8 years ago. I almost see it as, the welfare state is that safety net that children would otherwise look for in parents.
As you've heard, I'm Lauren, and yeah, so I was always that like really nerdy kid at school when they went around and like you had to say who your hero was, and everyone else was like their mum, and then I was there like Lord Beveridge because he like set up a welfare state, and I think that was fabulous. So it was absolutely amazing to be on this project because I was born 3 months premature, and so I've like had so many doctor's appointments, it's ridiculous.
So yeah, I've always been a person that's like been passionate about change and like the well-being of all people, others. But when I joined this project, I kind of realized that like I actually got to see, I actually got to witness the outcome and the start and the middle and all of that. And yeah, so it's been amazing to be a part of it and to actually be able to see the outcome of the project and where all the hard work is actually going to.
And it's kind of just been a huge realization for me that there's loads of people like me around us who know that we need to change the welfare state to better people, and to make it more supportive for everyone.
And being able to see how far it's gone, really. When I first started, I didn't know what it would really lead to, but I feel that we've created something that even we can never imagine at the beginning of this project, that there's actually people out there in influential places that are willing to hear from young people and feel that we can add to this conversation and can make a huge change has been really incredible.
We have taken a youth-led approach to design and deliver interviews, online surveys, workshops, and loads of other things with young people across England. Our research is aimed to find out young people's experiences of the welfare state, what works and what we need to change for young people. Young people's recommendations for radically changing the welfare state to do better suit the needs of the young people.
So who did we actually reach with our research? So in total, we spoke to 271 young people aged from 9 to 21 across England. This includes places like Bristol, Cumbria, Doncaster, Norfolk and Nottingham. We conducted 41 interviews. These interviews allowed participants to focus on 2 topics in depth, which provided us with a thorough understanding of their experience. We also conducted 11 workshops, 7 of which were over Zoom. When we first designed these workshops, we were hoping for them to be in person, face-to-face. So we're really proud that we were able to transfer onto the digital platform during the pandemic. We also conducted 165 survey responses. These were about 5 minutes, and they gathered the views of the branches of the ChildFair State tree, and these provided quantitative and qualitative data. So our research, the people that it represents, is a wide range of lived experiences, and this is something that we really wanted to highlight during conducting our research. So we have responses from people who have experienced mental health, know about the rural and urban divide of young people, people in the Roma community, people with special needs, people within the LGBTQ plus community, migrants and refugees, care leavers, invisible illnesses and disabilities, and supported accommodation.
we kind of found that a lot of people are struggling with mental health challenges and are thinking that the waiting times are too long, and that there needs to be a more tailored approach to mental health. Um, young people are also worried that they're draining the NHS in a whole, and I think it's just important to note that everybody needs a more tailored approach to healthcare and also to mental health treatments as well. That young people don't feel like they're being listened to, when professionals are making decisions. A lot of young people feel that services and specialists aren't communicating with each other, so that so they feel that they have to repeat themselves and they feel rushed. There needs to be more focus on prevention, and professionals and community organisations need to support people earlier on in order to prevent critical conditions. And I think that there needs to be services there when people ask for them, not just they have to go through this whole process of being referred and other stuff unless they've got a diagnosis. Only 45% of young people felt the mental health needs were met, and I think that speaks more volume than words as well.
There is a missing sense of community and a lack of cohesion among residents. Young people need more opportunities outside of religious groups. Many young people expressed feeling unsafe and a lack of security. This was often related to knife crime and gang violence. Most young people don't feel a part of the decisions being made within their communities, and there is a lack of empowerment. However, when they do feel a part of it, it's a really positive experience. Also on this one, I wanted to add that because when I was speaking to some young people about this, they said that they were a part of they felt like they were a part of their community when it came to the social side, but they didn't feel a part of it when it came to actually making changes in the community. Some young people with disabilities can't access youth groups and facilities independently. And then the quote over here is what we got from one of the young people, which is, "My village has a great community spirit, and when things are in control, we can make good things happen." Young people highlighted the importance of having community spaces to meet, to enhance communication and make decisions. I feel like I'm a part of a youth council as well, and I didn't hear about it through the actual things that are a part of, like I didn't hear about it through school or anything. I had to literally hear it from a friend of a friend of a friend who was actually a part of it. So I think they should be more out there. Young people said abandoned buildings felt unsafe and thought they could be used as community healthcare spaces instead. Young people felt protests and anger were bringing people together more than positive experiences, and we can use the Black Lives Matter movement for this. There is a concern among young people that communities will only come together for the COVID crisis, but this will not be sustained. So at the beginning of the COVID-19 crisis, there were like people on my street, they were like helping people with their shopping if they felt like they couldn't go out and things like that. But now that, well, before when it calmed down a bit, we didn't have any of that anymore. The statistic at the bottom says 55% of young people felt their needs were well met in the neighborhood. And the other quote was, "Not everyone feels at home, even when they are at home. So youth centers are essential to provide a space for young people so they can connect with other people." And I thought that was a very important quote.
The young people from the research thought that the purpose of education goes well beyond teaching, because essentially we go to education to learn, but at the same time we want to learn things that will help benefit us later on in life and things that we can refer back to. At the same time, the second point, it says that schools don't have the resources to look after their students' welfare and mental health. So that was kind of breathtaking to hear about, and also quite saddening as well. Point 3, students from lower income backgrounds are having to find part-time work to cover basic necessities, like transport and resources. So I think this touched on a lot to do with that material deprivation. And then finally, young people from the Black and ethnic minority backgrounds could be unfairly graded. So I think in relation to the algorithm, for example, that was released and the way in which it was like a really contentious issue, I think this would kind of fit into that greatly as well. So The first one says, a lot of people I know are very practical and have a lot of social and practical intelligence, whereas school nurtures academic intelligence. So I think this kind of directly links to the first and second point, where school shouldn't be a place of examinations, but it should be a place where you can go well beyond the curriculum. You come in with your own experiences. And then the second quote, school to me is I think that's gateway. School is my free zone, it's me time. So I think this kind of takes on a new vision or a new sort of imagination of what school is. So it kind of makes me think of like a second home where you go to school and you almost see it as a safety net. So point one, we need to find more imaginative ways to provide support. Young people need support to thrive, and schools need to nurture their curiosity. So I think this is about fostering to the different experiences that young people want to have and the different things that they're bringing into the schooling environment. And then we also need to trust and listen to young people. And then also young people wanting to be taught life skills. 66% of young people felt their educational needs were well met. So that's quite promising, I would say. When you have an understanding of how the world works and how society functions in general, you have more power to change it.
So in terms of housing, many young people talked about the importance of having a home, but also the precariousness of feeling like you don't necessarily have one. They also talked about there not being enough rentable properties for young people, but home ownership was still an ambition that they had. So I think that shows that there is still some hope in the future that things can be sorted out and that home ownership can be a possibility for everyone. And they also said that young people don't know where to look for advice on housing, and they felt if they didn't have parents who could provide this information, that support to update their knowledge was lacking. A quote from this section of the research is, I feel like if you don't have primary support at home, then I think it's hard to feel supported in other areas of your life. The young people also talked about how they faced a lack of power, control and fear from landlords, that there was a sense that they weren't aware of their rights and their entitlement to them, and they felt there was no state housing in place for them, which also gave that support. They also felt that housing should be more reliable and that you should be able to make it feel your own and to make it feel more like a home. They also mentioned how housing isn't just about the physical space, but it's more about what is around you. So for example, young people from the LGBTQ plus community, that even though you have a house, to make it feel like a home, you want to feel more comfortable by having people with a similar background to you or people that are quite understanding. And they felt that that linked more to housing than just physically having somewhere to stay. And 87% of young people felt their needs were met at home, which is also quite positive, which shows that although there is still some ways to go in improving housing, that at the moment they do feel like their needs are met. And another important quote we felt from this section was, we need to design homes around people. Home is different for everybody and we can't prescribe that.
So this is our key findings on welfare and benefit. So I think a key finding for the whole of the ChildFair State project, including all of the branches of the tree, was this idea of interdependency. The idea that no one is independent, regardless of whether you have a mortgage, a job. Everyone is dependent on the state for their healthcare, for their housing, for their children's needs, for their friends' needs, for that community. Young people feel that if the system was more universal, there will be a level of quality that everyone has access to. At the moment, it feels unfairly means tested. So at the minute, the benefit system only gets you the bare minimum, and it's clearly missing the key goal of purpose. A lot of young people talked about being stuck in the income poverty trap. We seem to be suffering from a lack of information, a lack of training and empathy on the front line. This is the inverse of what we need. If we're trying to motivate people, if we're trying to motivate people to move on with their lives. And this is the idea of a benefit system being a step up and a springboard, not just a net that catches you when things have gone really, really bad. There's a sense of punishment. People feel like they're asking for things they're not entitled to. So young people aren't getting enough money. In fact, they're getting less money than they need because of their age. And this was something that was raised again and again and again, that this discrepancy of money to age is really unfair. So only 40% of young people felt their needs were well met if they needed help with money.
Yeah, so sort of through all of this discussion, we sort of derived our, well, as Anna said, our values and principles. Oh, they've even been arranged alphabetically. That's quite pleasing. So it starts off with...
Sophie told us about her multi-layered vision for democratic neighbourhoods. It was fabulous. Here, young people felt safe, heard, respected, and took ownership of decisions within their community. Shoves invited us to Jigsawville, which kind of linked to Sophie's vision and was equally great. Was a multi-purpose, dense social housing site. Social housing that actually works, with recreational facilities, including The Haven, a space for young people to be themselves, which is brilliant. Morgan gave us an in-depth account of how to put healthcare back into the hands of the community, which was really interestingly linked to a World Health Organization paper that had just been published, and she introduced hubs and community healthcare workers. Jacob gave us a very moving description of healthcare in 2030, in which he'd very cleverly put in quotes from young people, so you always got the sense that we were following the vision from the people we've researched. Here, professionals were treated as people, and people were listened to with care. Tommy told us about his ideal healthcare system, which supports members of the community and focuses on prevention. His vision put equity at the forefront of our minds, ensuring all children had equal access to resources and basic necessities for their education, regardless of their background. I presented a vision for universal basic income, the greatest idea ever, which wasn't dependent on employment, income, or which family you were born into. Ronaldo's vision was for a diverse and inclusive education system, where both teachers and students were trained in racism and bias, and where students weren't made to choose between subjects at an early age.
When I was doing lots of the interviews and workshops, lots of young people asked also what's actually going to happen with what I've told you. I think it's been stated before that there are quite a lot of projects where we go into communities and ask young people their opinions, but they don't ever see anything coming to fruition from that. So I think for there to be a continued development of speaking with young people, because as we get older, there'll be other young people that are facing different issues, and to just have that continuation, sort of a cycle where we are including young people in this conversation.
So for me, I really like to see it going towards some legislation, some idea that these things you can't, these things you can't make worse. You can't reduce benefits below X point. There must be a certain amount of funding going into the NHS.
A young person could literally just say, oh, I want to go to the toilet, and everyone would be like, yeah, just because it's a young person saying it. So I feel like with this project, they actually made us feel like, yeah, we're actually being listened to and actually being heard. And it's not just because we're young, it's because of the amazing things that we are actually doing.
So I think more than anything with this project, it was about empathy and kindness. And I think when we first met the sounding board members in Sheffield, Lauren touched on this really well, how we have kind of diminished in a way as a society of kindness, and this project was kind of this beacon of hope that was bringing that back.
One of the most important things for me is that to think that I live in a country that when we were coming out of a war and everyone was so poor, someone stood up and went, actually, we could come up with holistic cradle to grave support. Isn't that a good idea? And 86% of the people went, yes, that's a fabulous idea.